The World Health Organization defines foodborne illnesses as including a wide variety of illnesses as a result of ingesting products contaminated with microorganisms, chemicals, or environmental contaminants.
Signs and symptoms of foodborne illness include nausea, vomiting, stomach cramps, and diarrhea. However, symptoms can vary depending on the disease.
According to the Center for Disease Control, there are over 250 different foodborne illnesses, so it is important to follow these tips and tricks to avoid getting sick.
Tip number 1. Avoid cross-contamination, especially meats.
Bacteria on the raw meat before cooking can then be transferred to the vegetables and can cause harm. Pro tip: to prevent cross-contamination, make sure that foods such as raw meat, poultry, and fish are stored below ready-to-eat and already cooked foods in your refrigerator. Also, use separate cutting boards or surfaces to cut meat and vegetables.
Each year, 48 million people get sick from a foodborne illness. 128,000 people are hospitalized, and 3,000 die. It can happen in many ways, even just by not washing your food.
Tip number 2 for avoiding foodborne illness: wash and scrub all of your fruits and vegetables under running water, even if you don't plan to eat the peel. This is so dirt and germs on the surface don't get inside when you cut. Also, make sure to cut out any bruises on the surface.
Now that we've talked about some tips to avoid foodborne illness, let's talk about the populations most at risk, which include pregnant women, young children, older adults, and immunocompromised individuals. Don't forget, it can happen to anyone.
The major social determinant of health for foodborne illness is lack of education about handling undercooked meats, cross-contamination, and the proper washing of fresh fruits and vegetables. In addition, minority populations who speak different languages may be at an increased risk for foodborne illness if they are unable to read food safety instructions on packaging.
Foodborne illness is a prevalent problem, so take action before you get sick. We recommend that nurses do all they can to educate on best practice. A system-wide intervention that could reduce foodborne illness in the population is to require food production companies to provide a label with clear, simple instructions on how to prepare meats, fruits, and vegetables before consumption.